Hi, everybody. Welcome to All Things Cancer. We are delighted to have Dr. Kathleen Ruddy with us today. She's an author, a breast cancer surgeon, correct? Surgeon? Yes. And we're going to be talking about the Pure Cure or the pink vaccine. It's a vaccine-based approach to dealing with cancer. And actually, let me open it to you, Dr. Ruddy. Can you talk a little bit about breast cancer vaccines, how they're used, and give us an overview.
Oh, well, okay. So from 30,000 feet, from the largest horizon. So we know in general what vaccines are. They are injectable agents that are used to target some infectious disease causing organism, a virus or a bacteria. And they identify sort of, well, shall we say, a feature, almost like the image that you have of the criminals, the most wanted list at the post office, the FBI. You go in, you see that they want these guys. Well, here are their faces, and so vaccines are able to recognize the face of hepatitis, the face of HPV that causes cervical cancer, the face of polio, for instance. And, if your body is primed, the way there are pictures at the post office, when it sees polio and it's been given the vaccine, your immune system then goes, whoa, most wanted polio, and it summons its army and it annihilates the polio virus. And this is true for other viruses and bacteria. Sometimes vaccines need only to be given once. Sometimes they need to be given several times. Sometimes, like influenza, they need to be given every year because the virus itself, the influenza virus, changes frequently. So vaccines with regard to the classic infectious diseases are well known and well understood. And for the most part, well accepted. There are a group of concerned citizens and some scientists who have some questions and reservations about the safety of vaccines, and I acknowledge and respect those concerns. I think by and large, vaccines have been the single most important intervention that medicine has introduced to prevent death and keep us safe and healthy. They can always be improved, but by and large, I think they're a major contributor to overall global health. The issue with regard to cancer and vaccines is relatively new in terms of its application. The concept has been around for 100 years because for at least 100 years, scientists have postulated that cancers may be caused by infectious diseases. That was met with a great deal of skepticism. And then it required a lot of advances in biotechnology and our general understanding of medicine and infectious disease before we could say, well, it's true, a virus can cause cancer. The first virus that was clearly identified as a cause of human cancer was the Epstein-Barr virus, a kind of herpes virus which causes Burkitt's lymphoma in Africa. And that is clearly an infectious disease. So it took a while for orthodox medicine to come around to the concept that cancers can be caused by viruses. But as soon as that was an accepted hypothesis, the next idea was, well, how about we make a vaccine? If we can prevent polio, why don't we prevent, whatever, cancers? And that was a little bit of, slow uphill going. But I think the major turning point was when we developed a vaccine that prevents hepatitis being the major cause of liver cancer. And so we wanted to prevent people from getting hepatitis because that makes them good and sick. But we also discovered that they then were protected from getting liver cancer. Slowly but surely, the question about HPV causing cervical cancer was settled, and the vaccine that prevents cervical cancer by targeting the human papillomavirus was introduced. And that has had its ups and downs. but it has made an impact. It has reduced the incidence of cervical cancer and has proven to be what we can say safe and effective. Now, back in 1936, John Bittner, who was working at Jackson Memorial Laboratory in Bar Harbor, Maine, discovered what he thought was a breast cancer virus, and it turned out that he was correct. They weren't able to prove that for about another 10 or 15 years, but there is a virus that causes breast cancer in mice, and over the past 50 years, that virus, or its, adapted version for other animals, has been found in rats, cats, dogs, monkeys, and humans. So that as of 2013, when the leader of this research on the breast cancer virus, Professor James Holland of Mount Sinai School of Medicine, he presented his 30 years of research on the breast cancer virus to the National Institutes of Health, a video which is kept at the National Library of Medicine, but you can also find it on my website. And he basically said, look, we believe that this virus is responsible for between 40 and 91% of human breast cancer. We are one step away from proving that. And the challenge, as I see it, because I've been deep in the weeds with this research for the past 10 years, is to really bring it forward. But there is a lot more standing in the way of coming to terms with the breast cancer virus than there was coming to terms with HPV. We can talk about that in a minute. Meanwhile, the Europeans got the memo about this breast cancer virus, and they are not waiting for someone in the United States to give it the nod. A year ago, a consortium of researchers from Israel, Saudi Arabia, and Italy have published a paper in which they have effectively made a vaccine that prevents breast cancer by targeting this virus in mice. They have also made a monoclonal antibody that can be used therapeutically against the virus, and they have created a blood screening test to find evidence of infection of the virus.
Wow.
That's the pink virus, and that's where we are, and that's the whole concept of cancer, viruses, and vaccines, a world which I believe is getting ready to explode, because this breast cancer virus not only causes breast cancer, it is implicated as a cause of non-Hodgkin's lymphoma and perhaps even some types of lung cancer. And that's just one of dozens of viruses that look like they sit at the threshold of the cause of many different kinds of cancer.
So Dr. Ruddy, the pink vaccine, would it be considered a primary preventative measure or a secondary preventative measure based on the fact that you describe it as a therapeutic vaccine?
Let's just create a little file folder here for the pink vaccine. The pink vaccine was the name that I gave to a vaccine that was developed at the Cleveland Clinic. They then immediately adopted that name. Thank you very much. And that vaccine does not target the breast cancer virus. That vaccine, which was created by Professor Vincent Tuohy, who is brilliant, is a completely different formulation of a cancer vaccine. And it has shown both primary prevention, which means you get the vaccine, you do not get the disease. So if you have a polio vaccine and you get your polio vaccine, you do not get polio. Secondary prevention is something that comes in and prevents that particular disease from unfolding or recurring, so on and so forth. So there are therapeutic vaccines that help increase perhaps longevity of patients who have cancer. Dr. Tuohy's pink vaccine is not specific for the virus. Dr. Tuohy's vaccine is specific for triple negative breast cancer.
Okay.
His vaccine has been shown in animal models to completely prevent breast cancer in 3 different types of mice. His vaccine also shows therapeutic benefit, so that in Dr. Tui's animal studies, when mice that would 100% of the time have gotten breast cancer are given his vaccine, none of them get breast cancer. This is very good. Then he took another group of mice and he let them go ahead and get their breast cancers. And then he inoculated them with the vaccine. And he found that their tumors grew more slowly. That would be a secondary prevention because you're trying to get in the way of this thing that has already happened. So the pink vaccine would be both primary prevention of triple negative breast cancer as well as potentially showing some therapeutic benefit. Now, where are we with the rollout of the pink vaccine? Dr. Tui is hoping that the FDA will give its approval to conduct a phase 1 study to show that his vaccine is safe. Because the first thing you have to do before you even get to the question, is it going to work, is it safe? Because if it's not safe, who cares whether it works? You can't give it. So the first study is a relatively small study. It will not take a lot of time, and it will answer the question, is this vaccine safe? If the vaccine is safe, and that answer should come in pretty quickly, then the next question will be, well, does it work, and how well does it work, and how many doses do you need? Do you need 1 dose? Do you need 3 doses? Do you need it every year? What do you need? So that's where we are, right there at the threshold. I think 2017 could be the year for this.
Wow. I want to back up a little bit. You were talking about the research that was done in Europe and with the Saudis and the Israelis. And you mentioned that they're looking at a monoclonal antibody. Where will that fit in terms of cancer treatments? Will it be an adjunct to chemotherapy? Will it be a standalone treatment? How will that be used?
Well, we can't say for sure, but let's just talk hypothetically. I mean, if you have a vaccine that prevents breast cancer in mice targeting this virus, then you're going to want to see whether or not you can leapfrog into people with such a vaccine targeting the breast cancer virus to prevent the disease. If you have a monoclonal antibody, what the monoclonal antibody will do is go around and scavenge like Pac-Man. Remember the old Pac-Man? You know, the first video game, Pac-Man. So the monoclonal antibody is sort of like a Pac-Man. That if you are infected with the virus, if you have a breast cancer that's growing because of the virus, then you give the monoclonal antibody. It's like little Pac-Man, goes in and eats up all those cells. So hypothetically, that monoclonal antibody, which again looks like it works well in mice, move forward to see whether that would work in women. And then, of course, the blood test, the screening test, is very advantageous because if, as we think, this breast cancer, like so many other cancers, is an infectious disease, then perhaps I'm infected, but I just don't have my breast cancer yet. And I would like to know if I'm infected.
Mm-hmm.
You know, like you screen people now for HIV. Nobody gets AIDS. Who gets AIDS? You get screened for HIV. You're found to have HIV, and you're given, this antiviral kind of cocktail, and you never get AIDS. You take these drugs forever, but you don't get AIDS. You have HIV, and so the ability to screen a population for infection with a breast cancer virus would allow us to identify those women who are truly high risk, and they would be followed closely. Perhaps they would be eligible for a clinical trial in which they would be given antiretroviral therapy because breast cancer virus belongs to the same group of viruses as HIV. So there's an interesting correlation there. And then the women who don't have a family history, are not infected with the breast cancer virus, well, they could probably be randomized to see, well, maybe we really only need to check in with them every 5 years or so. They don't need to be seen every year for an annual mammogram because they really have no risk factors, and these women have the high risk factors.
Now, with regard to the studies that have been done in mice, are they only done with female mice, or does it make a difference to include male mice? In addition, does this vaccine extend to male breast cancer?
Theoretically, it would, and that is a brilliant question that has not even crossed my mind. And the next time I get a chance, which will be tonight, I'm going to shoot Vincent Tui an email and ask him if he used male mice. one would think that they only used females, but I think you're really onto something, because we know from other animal studies that the virus is implicated as a cause of non-Hodgkin's lymphoma in male mice. We also know that in the mice population, the breast cancer virus is sexually transmitted. It is transmitted in mother's breast milk, but it's also sexually transmitted. It's also transmitted in seminal fluid. So it would be a very interesting question to ask. Even the group in Israel, that group that studied their vaccine in mice infected with the virus, did they include males in their population? So yeah, let's get right on that. Thank you.
You're welcome. Now, you also made the statement that the breast cancer virus behaves much like HIV. So given that, when we intervene with HIV with antivirals, what we find with HIV is mutations develop and it kind of changes a little bit, and we have to kind of switch in and out with the cocktail that those individuals need at any moment. Are we going to face the same thing with the breast cancer virus and this vaccine?
Well, I have no way to answer that question accurately, except to say I wouldn't be surprised if we run into those kinds of challenges and perhaps others. I think if we, again, let's go back to the 30,000 foot, aerial view of the problem. We've got a woman diagnosed with breast cancer every 20 seconds. We have a woman who dies every minute. Overall, the incidence of breast cancer is increasing around the world. If we were to prove that the virus is a major cause of human breast cancer, and we were to develop an effective preventive breast cancer vaccine, therapeutic monoclonal antibodies, ways to screen, any of the problems that we would run into down the road that takes us have got to be less daunting than the problems we are currently facing, just economically.
Right.
Not just in terms of lives lost, breasts lost, mothers, daughters, sisters, whatever. So yeah, I can't imagine that a vaccine that targets a highly mutable virus is going to be as easy a win as polio was, or as smallpox. It might surprise us, but it's always best to assume the worst and be pleasantly surprised.
Now, let's treat this as an infectious disease. Will the CDC at some point be involved in this vaccine development?
The CDC will not be involved in the vaccine development. Probably, as I see it, of course, the CDC could get involved anytime it wanted to, but if I'm going to sort of wave my hands over the crystal ball and say, well, what do I think this is going to look like? I think that the momentum is going to come from two loci. It will be the Cleveland Clinic's success in showing that there is a way to prevent breast cancer and that that's safe and effective. And at the same time, I believe the Europeans are not going to wait for the United States and the race for the cure to get religion here. I have a hunch that the Europeans are going to go full tilt, and that will be the secondary locus of momentum for movement on the breast cancer virus. Once that happens, I see it converging in multiple locations, because this is what happens when you get a tribe going, or a cult going, or a Facebook, thing, whatever, Twitter feed that's successful. You get a viral outbreak, and next thing you know, everybody is going to want to be, at the front of the bus, not even on the bus. They want to be at the front of the bus. And so I can see all of a sudden the NIH, which is well aware of this research, they invited Holland to give the keynote address at a major event that they had. So they're not going to be left out. Harvard's not going to be left out. The academic institutions here, the World Health Organization, all of a sudden everybody is going to believe and move very quickly in the direction of this. This is my hunch.
Mm-hmm.
It will be a collective aha, almost like global warming. You know, it's like, wait a second, you can still have skeptics out there, but it's getting mighty hot outside, you know, and really, come on, people, let's get a critical mass of consensus thinkers and thought leaders together, and let's move out on global warming, and we can see this happening. I see the same thing happening with the whole idea of viruses causing cancers, and this particular virus potentially causing the majority of breast cancer.
No, that was actually my next question, is what implications does this have for other types of cancer and other types of cancer research? I mean, it's huge.
It is huge, because I think that this is almost like, you know, going through the tornado and landing in Oz. The door opens, you know, you got a bump on your head, but everything is in Technicolor. Everything is in color. You know, you still got to get to Emerald City. But if we prove that this virus causes breast cancer, we already know that there are at least 6 viruses that cause other cancers. We know that the hepatitis vaccine prevents liver cancer, the cervical breast cancer virus, that works. We get to breast cancer, and then I think all of a sudden it's going to be like the open frontier, and we can look at things like glioblastoma, the brain tumor that killed Biden's son, and Ted Kennedy. We can look at melanoma. We can look at lung cancer. There are any number, well, we know skin cancer, for God's sake, yeah. So there are any number of cancers that all of a sudden people are going to say, well, what about my cancer? I don't have a ribbon, I don't have a month, but I may have a virus. So let's get on.
That is incredibly promising for people. But what kind of time frame are we looking at? Although that's the part I think that's always so frustrating for people dealing with cancer now, is you hear all this wonderful research coming down the pike, but what about me today?
Okay, well, let me just answer that question. And I'm going to answer that question with a tone in my voice, okay? So I will apologize for the tone in my voice. If we go the routine, orthodox, we're going to get around to it, yeah, that looks important, yeah, it's interesting, we like the data, kind of way of doing business with regard to vaccine development, okay, it's 10 years, it's 15 years. However, what if there were a real emergency? What if there was an Ebola outbreak in West Africa that looked like it was going to wipe out the world? And we had people flying around the country, all of a sudden landing in Minnesota with Ebola, landing in Brooklyn with Ebola. How long would it take us to make an Ebola vaccine? How long did it take us to make an Ebola vaccine that was 80% effective in preventing Ebola? How long did it take?
Not long at all.
3 weeks?
6 months.
6 months? Yeah.
6 months. Okay, Zika. Zika, oh my God, Zika, what the hell is going on with Zika? Zika's down in Panama, and Zika's down in South America, and Zika's in Brazil. Wait a second, Zika's in Puerto Rico. How long did it take us to get a Zika vaccine going?
No time at all.
6 months. Okay? Now, ladies, if you want to do it, you can do it quickly. Now, that doesn't mean that that Zika vaccine is 100% effective and it's perfect and all the little wrinkles have been ironed out. Same thing with Ebola. But the point that I'm trying to make is, when you decide as a nation, as a group, as a community, that you want to get something done, all of a sudden it gets done. How long did it take us to clean up Ground Zero at 9/11? Under a year.
Yeah.
Those 2 buildings came down to ash. And a year later, the place was clean as a whistle. You could operate at Ground Zero, okay? So when you want to do something, it can get done. I think that if we get to the point where we have convincing proof that this virus causes breast cancer, then I think women really should bang the pots and say, okay, if you can make an Ebola vaccine in 6 months, then you need to do it for us, because we're dying at the rate of 1 a minute, okay? And that's a lot. That's more than anybody died from Ebola or Zika.
What do you think the time frame is? Oh, I'm sorry, Steffi. No, just this time frame on firmly establishing this link.
Again, it depends on how fast you want to move. If you want to go with, you know, the melting of the polar ice caps. I mean, it might take a while, because how much money are we spending on this in this country every year? Well, how much money are we spending on breast cancer research? And on breast cancer, all breast cancer, 20 billion, back of the envelope, 20 billion. Of that 20, I tried to make a graph of this. You cannot make a graph of this comparison. $20 billion a year on breast cancer. How much are we spending on research on the breast cancer virus? $100,000. You cannot make a bar graph that shows the difference. I mean, it's negligible on the right side, and it goes through the ceiling on the left. If we were willing to put, oh, for God's sake, $100 million would be very generous. But if we could collectively assign $100 million to answer the question, does this virus cause breast cancer in women, we could get answers very quickly. We could get answers very quickly.
Where?
$100,000, the polar ice caps will melt and refreeze, and we still won't have the answer.
Where is the breast cancer community on this, in terms of their support of it? Because I would think if they have, I mean, do they have knowledge of the virus? And if they do, why are we not hearing the banging of the pots?
They are very well aware. When Susan Love was asked 4 years ago what she thought of the breast cancer virus, and she actually endorses the work of Holland, she said, I wouldn't be surprised. To the best of my knowledge, she has not done anything to fund the work. She has access to funds, she has not funded the work. Fran Visco, who runs the National Breast Cancer Coalition, is not particularly interested in this research. She's more interested in competing with Cleveland Clinic's vaccine. Even though Cleveland Clinic's vaccine was 10 years in the making and now 10 years working its way towards FDA, Fran Visco and the National Breast Cancer Coalition have decided that they're going to make their own vaccine. Susan Komen gave some money to research on the breast cancer virus, has not been particularly enthusiastic with funding it.
Now, is that because of, well, I guess, I don't want to interrupt your answer in my first question, but I think people don't understand. I think they've been convinced that early detection is primary prevention.
Yes. Why
is that a fair statement? Okay.
I've been convinced of that, and why is that? Why have they been misled? Why has the vocabulary changed? Primary prevention is you do something so that you do not get the disease. That's primary prevention. Why has it been that the community of women and the community at large are now under the mistaken notion that mammograms are primary prevention? Because the Komen Foundation and others did not have an effective way to put forth as primary prevention of breast cancer. They were persuaded of the benefits of early detection, which are not trivial. They were persuaded by the effectiveness of screening mammograms, and they are effective in finding early cancers. But in order to further advance and advertise mammogram screening, which allows Komen to receive a fair amount of funding from the companies that make mammogram machines, they played with the vocabulary the way Madison Avenue advertisers like to play with vocabulary, and they constituted a race for the cure because they were targeting the women who had breast cancer, who wanted to live. So we're going to have a race for the cure to cure you. And then everyone else who was interested, we're going to try and convince you that having a mammogram is a way to prevent breast cancer when it is not. And women will tell you, oh yeah, yeah, mammogram screening. It's all a bunch of baloney. It's all a bunch of baloney used to encourage mammogram screening, which could be encouraged based on its own inherent value, not based on the fact that it might convince women to have mammograms when maybe they might not think it was
And the lab screening that you had mentioned earlier in the interview, is that something that is a cost-effective screen for the virus?
The mammogram screening?
No, not mammogram. The blood screening for the virus itself.
Well, we're not there yet. We have, the Europeans have it in mice.
Mm-hmm.
The whole idea, and they're very clear in their conclusion. They're very clear that they want to bring this to prime time. They want to bring it into the human population. There's a lot of work to do before they get there. But that's where they're headed. That's where they're headed. So here in the United States, we're still headed in the direction where we've been for the past 30, 40 years, which is get your mammogram. Okay, that's how we're going to prevent breast cancer. No, that's not how we're going to prevent breast cancer. We're going to prevent breast cancer when we know what causes it and when we have effective ways to prevent the disease. And perhaps if Cleveland Clinic's vaccine works to prevent triple-negative breast cancer, that will be a step in the right direction. Benefited most are the women who don't even have cancer. And because we're human, if we're healthy today, we think we're going to be healthy tomorrow. And maybe my mother died of breast cancer and I'm going to run the race and buy the pink t-shirt, but I'm probably not going to get breast cancer. If I do, it'll be early detection and, I'll be okay and they'll have something. And it's really hard to preach to the people and convince them of the value of really moving forward. The advantage that the old time vaccines had in terms of polio, measles, whooping cough, is that you died quickly. Polio ripped through the community and people died and they were in iron lungs and they were crippled. And you could see very quickly, this was not just, you get polio, president got polio, and infectious diseases are the same thing, smallpox, measles, whooping cough, you died. And so they lined up for the infectious disease vaccines. It's a little bit harder sell to get them to line up for the cervical cancer vaccine because they think, well, I might not get it. I can get cured, whatever. There's a lot of people who think maybe it's not that safe. You get cervical cancer, it's a miserable way to die. I promise you, miserable.
I think the whole notion of cancer just has such a fear factor that people back away rather than taking charge.
Right. I know. But, that's our job, right? That's why we're here. We're here to explain it to them in a way that doesn't scare them, that is compelling, that assures them that there are legitimate data published by professors in peer-reviewed journals, that there's momentum, there's convergence of opinion, and that what is standing in the way, I think, bottom line, is a profit-driven healthcare system, plus a certain amount of academic inertia, but you always get academic inertia. They're never going to believe it until their stone tablets are behind the burning bush. Okay, there you go. But I think what's really standing in the way, more than anything, is that breast cancer is a huge business. It's a big business for the pharmaceutical industry. And even though I don't think there's a conspiracy, I do believe that if I'm an executive at a major pharmaceutical industry and I've got a half a dozen or a dozen drugs, some of which I can charge $300,000 a year for, and I've got another $500 million in the pipeline, I'm going to say, I'm going to look the other way to the vaccine and the virus. It's not a conspiracy. I'm not going to get in that game because I make money over here and I've got money I've already invested here, and I owe my job to the shareholders and the board of directors and my bonuses and blah, blah, blah. And I certainly don't want to be the one who makes a vaccine and makes $1 billion and that's it, case closed. $1 billion is all they're going to make on Gardasil, $1 billion. Well, they were not making all that much money on cervical cancer. They're making a lot of money on breast cancer. And that's the hurdle. That's the hurdle.
Well, it's interesting too, if the European efforts move forward more quickly, there really isn't anything stopping somebody from a little medical tourism and going over to Europe, getting tested perhaps, and getting a vaccine there.
Well, what will happen is this, because the Europeans cannot afford a race for the cure. They do not have a profit-driven healthcare system. They have a publicly funded healthcare system. And we will not get into the pros and cons of that. Suffice it to say, if you have a publicly funded healthcare system, you do not have all the money in the world to spend on healthcare, and you have to prioritize. And if there's a vaccine that can prevent the most common malignancy in women, you're going to go for that vaccine. And so I don't really think it will be a matter of medical tourism. I think it will be that the momentum will build in Europe, and they will end up with a vaccine that prevents breast cancer. And the women in the United States will not tolerate that disparity. And they will not say to themselves, we better fly to Geneva. They will say, bring Geneva to us. Okay? Yeah. And those pharmaceutical companies in Switzerland will be happy to show up in New York Harbor with their vaccines.
What else should we touch on in terms of vaccines in general, as well as vaccines in breast cancer? What do people need to know?
I think they know, and as much as they need to know based on this, long expository interview about the vaccines. I would encourage them to go to my website, breasthealthandhealing.org. There's a huge catalog of blogs and videos. The most important really, I think, is Holland's presentation to the NIH in 2013, which they can find a link on my website. So I would say, look, it's almost like, Consumer Reports. You're going to buy a new car. You're going to do some investigating. They say, this is the #1 car. Well, you're going to go out there and you're going to do some of your own research. So I would say, do some of your own research on the Cleveland Clinic's breast cancer vaccine, on the breast cancer virus, on the work that's being done in this country and elsewhere on the breast cancer virus. And then get yourself a large cup of tea or coffee and go poke around on the major breast cancer websites. What is the National Breast Cancer Coalition doing? What's their position? Susan Love, Komen. And then come to your own judgment about what you think is the state of affairs with regard to the breast cancer virus. And then if you feel compelled to get in the game, then get in the game. Go on Facebook, go on Twitter, make a contribution, show up at a meeting, talk to your tribe, okay? At least talk to your tribe. I think the more women talk about this, the more it will be moved from the periphery to the center. So much so that I got into this, I think I told you, in 2009 in particular. And now if you do a Google search, breast cancer virus, and you click on images, my face comes up. Okay. So if you talk enough about it, and you were telling me, your great success before we started the interview, and I think you're right. You just don't stop talking and don't stop pushing. and that's, I think, the key to success, without being overbearing, allowing people to come to their own conclusions, but putting forth this controversy and this dichotomy. If there's so much information about the breast cancer virus, if there are professors, Holland, Pogo, Levine, Tui, who are senior and highly regarded, if their papers are published in peer-reviewed journals, why is it not got the traction it deserves in the breast cancer philanthropic community? That's the question. Answer that question for yourself, and then do something about it.
That's a very interesting question, and people should look into that, because
And that's the call to action.
yes, it is. Absolutely.
Use your judgment. That's the bottom line. That's the call to action. Pursue it. Satisfy your curiosity, and then use your judgment. I trust people's judgment. I do. I think when you're given the information, I think Thomas Jefferson was right. The irregularities that we see in the public domain, this is the price we pay for freedom. But by and large, no doubt there's been progress in this country. No doubt there's been progress, not perfect progress. And I feel the same kind of faith in the community of women with regard to breast cancer. I trust them completely.
Well, the community of women out there has shown that they make a difference. When they get behind something, they make things happen. And I think that that is not too far off in our future when it comes to this breast cancer vaccine, which would be fabulous.
Yeah, right.
And Dr. Ruddy, will you let me know about the male mice?
I will. As a matter
Okay.
of fact, what I will do, it's going to take probably a bit of snooping and poking around, but what I will do is I will write a blog about that.
Oh, great.
Dedicated to you.
No, not necessary, but
Yes, well, no, you deserve it. And this is the wonderful thing about just getting out into the community and talking about this, because, you know, people like yourself just have like this like light bulb goes off, and it's a light bulb that, you know, I probably would be sitting around for 10 million years that would not go off, you know, so thank you. And I think that there are a lot of people like that out there that can make really valuable contributions. So really, it's great.
well, it's so good to see you again. Thank you for joining us.
You're welcome.
We appreciate it very much. And everybody, check out the website, breastcancerhealing.org. Is that correct?
It's breast health.
Breast
and
Healing.
Okay.
breasthealthandhealing.org. Yes.
healthandhealing.org. Thank you, Dr. Ruddy. Thank you very much.
Welcome.